Okay, welcome back to the deep dive. We've gathered quite a bit of material here, research, articles, clinical perspectives, all looking at this, well, this condition often called old dog vestibular syndrome.
And it's a good topic because, honestly, when you first see it, it looks incredibly scary.
Yeah, alarming is definitely the word. You see your dog suddenly unable to stand, head crooked, eyes darting. I mean, your mind immediately jumps to the worst, right? Like a stroke.
Absolutely. It's terrifying for pet owners, no question.
It really is. So our goal today is to, unpack these sources, sift through the information, and try to replace some of that fear with understanding.
Right. We want to get into what the evidence says is actually happening, why it seems to come on so fast, how vets figure out it's this and not something, well, worse.
And crucially, what the outlook usually is. We're aiming to take all this data from the sources and give you a clear picture.
Okay, let's start with the basics then. Based on the material, what exactly is this geriatric vestibular disease?
So the sources consistently define it as an acute sudden onset disturbance. And importantly, it affects the peripheral vestibular system, specifically in older dogs.
And that peripheral part is key. The sources were really emphatic that this specific idiopathic form is not a stroke.
Right. Not originating in the brain, the central nervous system.
No, and not a vascular event like a lack of blood flow causing damage, which is what people often fear with stroke-like signs.
Gotcha. And it seems pretty common based on what we read. Just pops up.
Yeah, described as common, sporadic,
Yeah.
typically hitting dogs over, say, 8 years old. Interestingly, while one source hinted maybe medium to large breeds are seen more often, most agreed there's no definitive breed link. It can happen to any older dog, really.
So to understand what's going wrong, maybe a quick detour into the vestibular system itself. What does it actually do?
Sure. Think of it simply as the body's balance and orientation center. It tells the brain where the head is in space, basically. It keeps you upright.
An internal gyroscope. And the sources mentioned two main parts.
Yep. There's the peripheral part that's located out in the inner ear in the labyrinth, and also involves the balance part of cranial nerve 8.
Cranial nerve. Isn't that the hearing nerve too? Vestibulocochlear.
That's the one. It handles both balance and hearing. But here, it's the vestibular, the balance component that's affected. And then you have the central part, which is, deeper inside specific areas in the brainstem and the cerebellum.
Okay. And this specific condition, the old dog version, is idiopathic peripheral vestibular disease. Break that down.
Right. Peripheral tells us the problem's out in that inner ear, or the nerve, not the brain itself. And idiopathic, well, that's the kicker.
Means they don't know the exact cause.
Exactly. Idiopathic means cause unknown. The papers we look at threw out some theories, possibilities, but nothing concrete is proven for why it just suddenly happens.
What kind of theories did they mention? Anything stand out?
Well, they talked about maybe abnormal fluid flow in the inner ear canals, the endolymph, or perhaps some kind of intoxication affecting the balance receptors there. Maybe inflammation of the nerve itself, cranial nerve 8.
But no smoking done?
Nope, just theories. It remains a bit of a mystery why it strikes like this.
Huh. Interesting that something so dramatic doesn't have a clear why yet. Okay, so we know roughly what it is and where it happens. Let's talk about what you actually see. Because as we said, the signs are sudden and pretty dramatic.
Sudden is the word. Acute onset. Like bang.
Yeah.
It happens quickly. And the signs can be really quite severe.
Walk us through the main things an owner might notice. The scary stuff.
Okay. Top of the list usually is the head tilt. Can be mild, can be really pronounced, almost always tilted towards the side with the inner ear problem.
Okay. Head tilt. What else?
Major loss of balance. They call it ataxia. Basically, they look drunk, stumbling, staggering, leaning hard, sometimes falling right over.
Towards the head tilt side, you said?
Often, yeah. Leaning or falling towards that side.
Right.
In really bad cases, they won't even try to stand up.
Yeah.
They might also circle, again, usually towards that affected side.
Wow. I can just picture that. A dog that was fine yesterday suddenly unable to walk straight must be terrifying.
It is. And then there are the eyes.
The flickering.
Yeah, nystagmus. Rapid involuntary eye movements. Super common early on. Usually it's side to side, horizontal, maybe sort of rotational.
Okay.
And a key diagnostic point the sources highlighted. The fast flick of the eye is always away from the direction the head is tilted.
Ah, okay. So if the head tilts right, the eyes flick fast to the left.
Exactly. It's a consistent pattern. And all that spinning sensation,
Yeah.
well, it makes them feel awful.
Leads to nausea.
Definitely. Nausea and vomiting are very common, just like severe vertigo or bad motion sickness in people.
Which understandably would make them seem confused and not want to move.
Right. They often appear disoriented. And because moving makes the dizziness and nausea worse, they become really reluctant to stand or move.
Which could lead to not eating or drinking.
Yep, anorexia, either too sick, too dizzy, or just can't manage to get to the bowls. One other thing, less common, but possible, is facial paralysis on that same side.
Like a droopy lip or ear.
Yeah, that happens because the facial nerve, cranial nerve 7, runs really close to that vestibular nerve, cranial nerve 8. Sometimes it gets caught up in whatever's going on nearby.
So you put all that together, the staggering, the tilt, the eye flickering, vomiting, not moving, you can absolutely see why people think stroke.
Without a doubt.
Yeah.
And these signs, the sources say, they're usually at their absolute worst in the first, 24 to 48 hours?
That's typically the peak, yes. The initial shock and severity is usually in that first day or two.
Okay, so given how much this looks like a stroke or something else really bad, how does a vet figure out what's actually going on? The diagnosis must be critical.
It's absolutely key. And the consensus in the material we reviewed is that diagnosing this specific idiopathic condition is largely a process of exclusion.
Meaning you rule other things out first. Exactly. You systematically eliminate the other possibilities, especially the more serious ones or ones that need different treatment. It's not like there's one blood test that says, yep, it's this. It's diagnosed after ruling other things out.
Makes sense. So what are the steps involved in that exclusion process, according to the sources?
Well, it always starts with a really thorough history from the owner.
Asking about the dog's age?
Crucial, yes. Older dog is typical, then the suddenness of onset, the exact signs you saw, any history of ear infections, that's a big one. Any trauma, toxin exposure, medications, other health issues like hypothyroidism.
Okay, get the backstory, then the hands-on exam.
Right. A general physical exam first, check vitals, overall health. But then a really critical part is the ear examination.
Why focus so much on the ears right away?
Because a very common cause of peripheral vestibular signs is actually an inner or middle ear infection, otitis media or interna, and those are often treatable with antibiotics.
Ah, okay, so
Yeah.
you need to look for that.
Definitely. The vet uses an otoscope to look down the ear canal. They're checking for infection, discharge, foreign objects, maybe a ruptured eardrum, signs that point towards an ear infection as the root cause.
And if the outer ear looks okay, then the neurological exam comes into play. That's where you differentiate the location.
Precisely. The neurological exam is where the vet tries to pinpoint whether the signs point to a peripheral issue out in the ear or nerve or a central issue, meaning something going on in the brainstem or cerebellum.
Okay, let's revisit those differences again. Based on the sources, peripheral signs are...
Peripheral, sudden onset, head tilt, that horizontal or rotary nystagmus, the ataxia, nausea, but crucially, normal mental status. They're alert, maybe distressed, but mentally normal. And their limb strength and proprioception, knowing where their feet are, that's usually normal too. The only other potential nerve issue is that facial nerve palsy we mentioned.
Okay. And central signs suggest a brain problem. How do they differ?
Central signs often look more severe, or just different. You might see changes in their mental status, depression, lethargy, even stupor. And a huge red flag for central disease, mentioned repeatedly, is vertical nystagmus, eyes flickering up and down.
That almost always means brain.
Almost always points to a central lesion, yes. You'll also often find weakness or proprioceptive deficits, knuckling over, dragging toes in the limbs, typically on the same side as the head tilt. And you might find other cranial nerve problems like difficulty swallowing or changes in facial sensation.
So the type of eye movement and whether there's weakness or mental dullness are really key differentiators.
Absolutely critical, based on the neuroexam findings described in these papers.
What about other tests? Blood work?
Standard practice, blood tests, CBC, chemistry panels, sometimes thyroid levels. These check for infection, inflammation, organ function, metabolic problems, and rule out hypothyroidism, which can rarely mimic some signs.
And if the exam does suggest central disease, or they can't rule out a deep ear infection just by looking, or maybe the signs aren't improving like they should.
That's when advanced imaging comes in. CT scan, or even better, an MRI of the head.
MRI gives more detail of the brain.
Much better detail of the soft tissues, yeah. The brainstem, cerebellum, and crucially, the middle and inner ear structures that you can't see with an otoscope. They're looking for tumors, inflammation like meningitis or encephalitis, signs of a stroke, or deep ear infections.
Any other specialized tests mentioned?
Sometimes CSF analysis collecting spinal fluid if brain inflammation is suspected. And one source mentioned BAER, testing brainstem auditory evoked response. That checks the hearing pathway, which uses part of cranial nerve 8, and can sometimes help assess for middle ear issues, though old dogs can just be deaf for other reasons too.
Okay, so it's a puzzle. You take the history, the physical, the neuro exam findings, especially peripheral versus central signs, rule out obvious ear infections, check blood work, and use imaging if needed.
Exactly. And if, after all that, you've reasonably ruled out central problems and treatable ear infections, and the picture perfectly matches that sudden, non-worsening peripheral pattern in an older dog, then you land on the diagnosis of geriatric idiopathic vestibular disease.
A diagnosis of exclusion, like you said. Okay, so you get the diagnosis. Idiopathic means unknown cause, and you said it typically resolves on its own. So how do you treat it? What do you do?
Right, that's the next logical step. And the sources are very consistent here. Treatment is almost entirely supportive care.
Meaning you just manage the symptoms.
Pretty much. Because there's no specific underlying cause to cure in the idiopathic form, the whole focus shifts to making the dog comfortable, keeping them safe, and supporting them while their body sorts itself out, which it usually does.
Okay, what does that supportive care actually involve? What's priority number one?
Dealing with that intense nausea and vomiting. It's miserable for them. So, antiemetic drugs are key. Medications like meropitant Cerenia is a common brand name, or metoclopramide. They help control the vomiting, reduce the dizziness sensation, and often help the dog feel well enough to maybe start eating or drinking again.
What about human motion sickness meds? Did the sources mention those?
They did, things like Dramamine or Bonine. But the consensus seemed to be their effectiveness in dogs for this specific condition is kind of questionable, or maybe less reliable than the veterinary-specific drugs.
Okay, so manage the nausea. What else is vital for support?
Safety and nursing care are huge. Because they're so unstable, you need to provide a safe, padded space where they can't fall and hurt themselves. Confining them to a small, safe area is often best initially.
Helping them move.
Yes, if they're really wobbly, you might need to assist mobility with a sling or even just a towel under their belly to help them get outside for toileting or just to change position. And hydration and nutrition are critical. Offer water and maybe small, bland meals frequently. But if they're vomiting persistently or just too disoriented, they might need fluids, either under the skin, subcutaneous, or, in more severe cases, intravenously.
So hospitalization might be needed sometimes.
It might, yeah. Especially for dogs who can't stand at all, or severely nauseous, or need IV fluids to stay hydrated. But many milder cases, the sources suggested, can be managed effectively at home with really good nursing care from the owner.
Keeping them clean and dry if they can't move much.
Absolutely. Hygiene is important, preventing urine scald or pressure sores if they're lying down a lot. Gentle range of motion exercises, helping them change position regularly if they can't do it themselves. The level of activity restriction really depends on how unstable they are.
Were there any treatments the sources specifically said not to use for this idiopathic form?
Yes. One group was specifically mentioned, glucocorticoids like prednisone or other steroids. The rationale given was that they don't actually change the course or speed up recovery for the idiopathic condition.
And they can have side effects.
Right. They can increase thirst, urination, potentially complicate hydration or hygiene, and aren't considered beneficial for this specific problem. So the recommendation was generally to avoid them unless there's another specific reason.
Okay. But if the diagnostic workup did find something else, an ear infection, hypothyroidism.
Well, then the treatment changes completely. You treat the underlying cause. Antibiotics for the ear infection, thyroid medication, treatment for a tumor if found, stopping any potentially offending drug. That becomes the focus. But for idiopathic, it's all about symptom management. And a huge part of that is client education.
Reassuring the owners.
Exactly. Making sure they understand that even though it looks horrific initially, the prognosis is usually very, very good.
Okay, let's talk about that prognosis then. This is probably what everyone listening really wants to know. After seeing their dog go through this, what do the sources say about the likely outcome?
And this is where the really good news comes in. Across the board, the prognosis for idiopathic geriatric vestibular disease is described as generally excellent.
Excellent. That must be such a relief to hear after witnessing those signs.
It really is. The typical recovery timeline outlined in the research goes something like this. You usually start to see improvement within about 72 hours.
3 days or so, what improves first?
Often the vomiting stops, the nystagmus starts to lessen, and the ataxia, the wobbliness, begins to get gradually better.
So improvement starts pretty quickly, relatively speaking.
Yes. Then you see significant improvement over the next 7 to 10 days. They become much more stable, more comfortable.
And that time frame is important diagnostically too, right?
Yes. That was the key point. If a dog shows absolutely no improvement within that 7 to 10-day window, the source is stressed, you really need to go back and reconsider the diagnosis. Look harder for other causes, because uncomplicated idiopathic cases should be showing progress by then.
But for most dogs fitting the idiopathic profile, they just continue to improve.
That's right. The vast majority are described as returning to essentially normal function within 2 to 3 weeks.
Wow, back to their old selves that quickly.
Pretty much, yeah. Most make a full functional recovery.
Are there any lingering effects sometimes?
The main one mentioned is that mild residual head tilt. Some dogs might keep a slight tilt permanently.
Does that bother them?
Apparently not much. The sources indicate the dogs adapt incredibly well to a mild tilt. It doesn't usually impact their quality of life. They just look a little quirky.
Any potential bumps in the road during recovery? Complications?
The main risks are secondary things, like dehydration from vomiting if it wasn't managed well, or maybe pressure sores if they were down for a long time. Recurrence is possible, though considered uncommon. A few sources mention stress as a potential, though unproven, trigger for recurrence in some individuals.
And follow-up-wise, just checking in with the vet.
Typically, yeah, a recheck in maybe 2-3 days,
Yeah.
just to make sure things are heading in the right direction, they're stabilizing. And if they were hospitalized, they usually go home once they can walk reasonably well, eat, drink, and manage without intensive support. So yeah, the initial presentation is absolutely frightening, no doubt about it. But the story these sources tell about the typical course and outcome is actually very positive.
Okay, let's wrap this up. Let's recap the big takeaways from this deep dive into the sources on old dog vestibular syndrome, or geriatric idiopathic vestibular disease.
Well, we started with that really alarming sudden onset of signs: head tilt, severe imbalance, nystagmus, nausea looking very much like a stroke.
But learned it's usually caused by a disturbance in the peripheral balance system, the inner ear or associated nerve, not the brain itself, in this specific idiopathic form common in older dogs.
Right. And the diagnosis relies heavily on a careful process of exclusion, ruling out brain problems, ruling out treatable ear infections through thorough examination and sometimes further tests.
Then the treatment for the idiopathic form is primarily supportive care, managing the symptoms, especially nausea, keeping them safe and comfortable.
While the body usually heals itself quite remarkably.
And the best news, the key message from all the sources, is that excellent prognosis. Most dogs start improving within days and are largely back to normal within 2 to 3 weeks.
Maybe with a bit of a permanent head tilt as a souvenir, but functionally doing great.
It really highlights how crucial diagnosis is, right? Going from sheer panic at seeing those signs to understanding what it is, what to expect, and knowing the outlook is usually so good.
It's a testament to the diagnostic process and also just the resilience of these animals.
Absolutely. Which kind of leaves us with a final thought, perhaps. Just reflecting on that incredible ability of the body, animal or human, to find its way back. Even when things seem completely terrifyingly out of balance, there's often this amazing capacity to recover and adapt, to find equilibrium again.